Medical gaslighting is the experience of having symptoms minimized, discredited, or written off as things like it's just stress or it's all in your head. And it is an interaction with a healthcare provider that can leave a long, deep mark. Hi, I'm Valerie, a registered nurse and health educator. My goal in these wellness research brief videos is to translate current research into plain language and practical guidance that you can actually use. Two recent studies that I came across made me think that this is a topic that I should cover because it is an overlooked factor that has a real effect on wellness. These two studies are a 2025 rheumatology study on psychosomatic and psychiatric misdiagnosis in autoimmune diseases and a 2025 psychological bulletin review on symptom invalidation across hard-to-diagnose conditions. In this video, I will be discussing what they found, how it shows up in real life, and what you can say and do both for yourself and for people you care about. During a doctor's visit, invalidation often sounds deceptively gentle. You may be told things like, your tests are normal, I think this is anxiety, or try to relax, it is probably nothing serious. Or maybe you're reading too much into this. Now, this usually is not because clinicians are intentionally trying to harm their patients or blow them off. In fact, they interviewed doctors in these studies, and the doctors were genuinely surprised and saddened to hear how much distress their words caused. Several doctors explained that when they told a patient symptoms might be stress-related, they thought that they were offering reassurance. But understandably, for patients who knew something was deeply wrong, that reassurance felt like dismissal, and the damage was profound. The intent may be reassurance, but when your body is sounding alarms, reassurance without a plan feels like disbelief. The Psychological Bulletin Review examined 151 qualitative reports covering over 11,000 people with conditions that routinely generate uncertainty among doctors. So conditions like autoimmune disorders like lupus and Ehlers-Danlos syndrome, fibromyalgia, irritable bowel syndrome, long COVID, and others like those. The authors found that when symptoms were dismissed or minimized, it resulted in 4 types of harm to the patient. These 4 types of harms were worsening emotional health like self-doubt, shame, and depression, negative feelings about healthcare like anxiety, anger, and loss of trust, changes in behavior like avoiding care or downplaying symptoms, and a longer time to reach an accurate diagnosis on average. So on average, this resulted in a delay of 6.7 years, and that is quite a long time to go undiagnosed. And something else that came from this review is that visits where someone comes in with symptoms but no clear name for the problem are now the fastest growing type of medical appointment. That growth reflects how many modern conditions are complex, contested, or still misunderstood, and how easily uncertainty can turn into invalidation when communication breaks down between patient and provider. The second study, published in Rheumatology, examined people living with systemic autoimmune conditions like lupus, Sjogren's, inflammatory arthritis, and related conditions. A common part of their journey was that before receiving a diagnosis, many were told that their symptoms were psychosomatic or purely psychiatric. So basically, they were told that the problem was all in their head, even though their body was clearly signaling that something was wrong. More than 8 in 10 said that label damaged their self-worth, and 72% said it still upsets them years later. Compared with people misdiagnosed with another physical condition, so this is people who received an actual diagnosis, even if it was wrong, The group who were told that it was basically all in their head reported lower mental well being, higher depression and anxiety, and less satisfaction with almost every part of their medical care. They were also more likely to avoid appointments or underreport symptoms, not because they stopped caring, but because they developed a fear of being dismissed again. Using a framework called the patient health engagement model, the researchers explain that this happens because having symptoms invalidated destroys someone's confidence and makes it harder for them to ask for help, leaving some people feeling powerless and less involved in their own care. The researchers also used attachment theory to explain that when early encounters feel invalidating or dismissive, the doctor-patient relationship feels shaky to the patient. People then start to question their own worthiness of care and doubt a clinician's good intentions or availability, which makes future trust much harder to rebuild. In the study, the authors observed that this leads to people underreporting symptoms or delaying seeking help later. And again, it's not because they have stopped caring, but because the foundation of trust was shaken early in the doctor-patient relationship. When someone's symptoms are brushed off by a doctor or other healthcare provider, it leaves people feeling embarrassed, ashamed, confused, and even angry. Then, before their next visit, they start second-guessing themselves. Some even begin to wonder if they are imagining things. Others might go in the opposite direction and start watching their body closely for every little sign because they have learned not to trust that anyone else will take it seriously. These reactions come directly from the people interviewed in these studies. The rheumatology paper included some quotes from the participants in their own words, while the psychological bulletin study pulled together similar stories from over 11,000 people with conditions that are often hard to diagnose. Across the board, people talked about shame, isolation, low self-esteem, and in some cases, even suicidal thoughts. They also talked about how they began avoiding appointments or downplaying their symptoms. And when that happens, it delays diagnosis while also chipping away trust in the healthcare system. In the rheumatology study, people who were labeled as psychosomatic didn't just lose trust in one doctor. They started to lose faith in the whole system. Many did eventually find a provider that they trusted, but they entered those relationships cautiously. And that caution can carry a cost. If you are holding back symptoms or waiting longer than you should to get help, that affects your care even when the next provider is someone who actually wants to help. Now, all these reactions are pretty predictable responses to being dismissed. When someone tells you your symptoms are just stress or in your head, it shakes two basic things that most of us bring into a doctor's office. The first thing is that what we are feeling is real. And the second is that someone will help us figure it out. When those two things get pulled out from under you, your mind and body start doing what they can do to protect you from getting hurt again. And for some people, that means pulling back. So they start keeping quiet about their symptoms, or they skip appointments, or they brush things off themselves. For others, it means staying on high alert, like monitoring every symptom, afraid to miss something. These are different behaviors, but they come from the same place of trying to avoid feeling ignored or embarrassed again. There is also a kind of learning or like conditioning that happens over time. If the first few times you ask for help, you are told that it is nothing, your brain starts to connect going to the doctor with feeling dismissed. That makes it harder to speak up the next time, and that delay can push back a correct diagnosis. If any of this sounds familiar, there are steps that you can take that do not require a confrontation or trying to force someone to believe you. One of the most helpful things is to be specific. If you are still looking for answers or worried that your symptoms might get dismissed again, try keeping a symptom diary or log. You don't need anything fancy. Just write down the symptoms, when they start, how long they last, how it affects your day, and anything else that you have noticed that makes it better or makes it worse. That information gives structure to what you are feeling, and structure makes it harder to wave away. Before the visit, think about how to sum it up in 1 or 2 sentences. For example, for the past 6 weeks, I've had joint pain that wakes me up most nights and has kept me home from work 3 times. That kind of detail gives the provider something to work with, and it shifts the focus from how you feel to what is happening in your life. It is also okay to ask for a plan, especially when your test results are normal, but your symptoms are not. You can say something like, my tests are coming back normal, but I'm still having symptoms that affect my day. What are the next steps to look into this further? That keeps the door open without making it about whether they believe you or not. And if the plan that they give you is to watch and wait, then ask for specifics. What symptoms should you track? When should you come back? What would count as a red flag? These questions show that you are engaged and paying attention, and they create a shared plan instead of leaving things vague. You can also bring someone with you. A friend or family member can help you stay grounded, remember what was said, and even speak up if needed. Something as simple as, I've seen how this affects them at home, can carry weight in a room where things might feel uncertain. And finally, know that it is okay to get a second opinion. That does not mean that you are being difficult or dramatic. It means that you are taking your health seriously, especially if your symptoms are complex or do not fall into clear categories. Seeing someone who has experience with those type of cases can make all the difference. I have worked with plenty of people who, once they got in with the right provider, they started to get the answers that they needed. Now, I do want to take some time to mention that this does not mean that anxiety or depression are not real. They absolutely are real, and they do deserve proper care and attention. Sometimes those conditions do play a role in how we feel physically, and sometimes they show up alongside a physical illness. That is not the problem. The problem is when those labels are used too early, or they are used instead of continuing to investigate what is going on in your body. One of the studies pointed out that people who were misdiagnosed as psychosomatic or psychiatric ended up experiencing ongoing emotional distress. And in some cases, this even led to new or worsening anxiety and depression. In other words, being told that it's all in your head can actually create distress. So this is not about rejecting mental health care, but rather it is about making sure that it is not used as a shortcut or an easy way out. If someone is still having physical symptoms that have not been explained, the job is not done. It is okay to treat both, and it is okay to say to your provider something like, I understand that you're considering anxiety or stress, but I'd also like to keep looking at possible physical causes. Getting care for your mental health does not mean giving up on finding a physical explanation. You are allowed to pursue both, and any provider who respects you should be able to do the same. There is no quick fix for a system that sometimes gets it wrong, but studies like these are a good start. This research does point to some clear ways that things could get better in the healthcare system. Clinicians need more support to sit with uncertainty instead of rushing to label something as psychosomatic. Saying, I don't know yet, needs to be more accepted. Medical records should reflect when a diagnosis is provisional, especially if it later turns out to be incorrect. And when someone finally does get the right diagnosis, there needs to be space to acknowledge what the patient went through, not just with a prescription, but with an apology, a conversation, and a clear path forward. So those are all system level changes, and you are certainly, as the patient, not responsible for those changes. But the studies do also show what helps in the meantime. And it starts with recognizing what that invalidation can do. When people feel dismissed, they are more likely to avoid care, delay speaking up, or try to manage it on their own. So if you catch yourself doing those things, like waiting too long to call, or downplaying your symptoms, or telling yourself that it's probably nothing, it is worth checking in with where that hesitation is coming from. And this does not mean that you are doing something wrong. It usually means that you have learned that asking for help doesn't always go well. But those patterns can shift, even if slowly. So, like writing things down before a visit, or bringing someone with you, or asking clear, direct questions, or making sure that your records reflect your current diagnosis. These are all small steps that can add up. They help you stay engaged in your own care, even if the system hasn't earned your trust. And over time, those steps remind you that your experience is real and it does matter, and that you still deserve care that you can trust. Being told that your symptoms are just stress or all in your head can have real and lasting effects. It can negatively impact your mental health, delay a correct diagnosis, and make it harder to trust the very people who are supposed to be helping you. These events happen way too often across conditions that are often hard to diagnose, like autoimmune disorders, long COVID, fibromyalgia, and others. And I've even seen this happen across common conditions like heart disease, especially in women, and also osteoarthritis. But there are ways to respond. Clear symptom stories, simple follow up questions, accurate records, and also having support in the room can shift the conversation. These are practical tools that can help you stay in the process. They help you stay connected to care that works for you as we wait for the healthcare system to iron out this rather large wrinkle in its system. If you found this video helpful, please give it a like. That lets me know that more content like this is needed. And if you would like some one-on-one help with this, I do have 20-minute consultation calls available. I am passionate about patient empowerment, and I would love to help you. Please share this video with anyone who you think might benefit from it, and subscribe to my channel for more evidence-based guidance on how to live a healthier, longer life. And if you would like to support my mission here, you can do so by hitting the thanks button below and making a small donation. Thank you so much for watching. And as always, please take good care of yourself.